Canada's ERs are being overrun. Wait times are getting longer, patience is running thin, and healthcare workers are increasingly overwhelmed.
Nurses are kicked, spit at, bitten. It's unbelievable. People wouldn't think that that happens, but it happens every single day.
The problem, as some healthcare experts see it, is that far too many Canadians look to ERs as their go-to for healthcare, in part because of a shortage of family doctors. Teddy Wickland of startup Medimap says Canadians have other options with specialists and clinics that his website connects to that are not only open, but mostly free of lineups.
Without tools and technologies like this, patients, might Google and not know that there's a clinic literally a block from them that has availability, and they just end up missing that because there's so much sort of opacity in the system. It's just really hard to see it.
You can find and book same day or next day appointments.
Is it the solution? No, but they believe they can at least ease the burden on ERs, similar to how virtual visits did in early 2020. Pre-pandemic, under 1% of all doctor appointments were virtual. By April 2020, necessity saw that number rise to 70%. As offices opened, the percentage dropped. And now, as wait times have increased, Maple Health, whose services are not covered by all provincial health plans, estimates virtual is back up to around 40%.
Our last couple of months have been, I would say, amongst the busiest that we've seen since the beginning of the pandemic.
However, the College of Physicians and Surgeons in several provinces, most notably Ontario, Quebec, and BC, has tightened the rules around virtual care, warning doctors that if something goes wrong in a virtual appointment and they're unable to see that patient in person, they could be guilty of professional misconduct.
But what we're seeing now is a lot of doctors saying, I'm not willing to see that patient that's in Sudbury because if I can't fully solve their issue, there's no way that I'm going to be able to physically see them in my office. And so we're seeing a lot of physicians really be much more limited in terms of what they're willing to treat.
And that, he says, is putting limits on a healthcare system that needs all the help it can get. Mike Drolet, Global News, Toronto.